Watched on, thank you. Coronavirus deaths and cases have dropped nationwide, but are still running at high levels.
Yeah, the effort to snuff out COVID-19 is becoming more urgent as mutations spread. Deaths are running at just under 3,100 a day, with cases averaging about 170,000 a day. Virginia reported more than 6,000 of those new cases today after days of below average cases.
And a new model from UVA shows cases increasing until a peak sometime in mid-February. But new variants of coronavirus could change that. When factoring these into the UVA model, we could see a possible peak in April.
And today, we learned of the first case of the UK COVID-19 variant detected in Virginia. The variant was detected in an adult from Northern Virginia with no recent travel history. 10 on your side's Brett Hall has what you should know about this.
As healthcare workers and first responders work to keep up the fight in a time when the average number of daily new coronavirus cases in the Commonwealth has reached record amounts, a new threat.
It has one particular mutation in the spike protein, which makes it of concern.
The first case of the COVID-19 B.1.1.7 variant is here. Dr. Edward Oldfield, a longtime infectious disease expert at the Eastern Virginia Medical School, explains in a webinar tonight that what we've all heard about with this new strain being more contagious appears to be true.
It binds much better to the human cell, so it's somewhere around 50 to 70% more infectious than the old strain.
He says what is still up in the air is how it might affect your body.
Most of the data suggests it's not more dangerous than the old strain, but there's some recent data out of the United Kingdom that suggests it may be a little more aggressive and dangerous than the old strain.
As nobody particularly wants to be the first person to test any of that research, Dr. Jordan Asher with Centera wants to remind people again.
We know what we can do to really help this issue.
Just as with the other strain of the virus, it spreads best person to person. Social distancing and mask wearing will help stop its spread.
Now it's not the time to fumble the ball. Now it's time to really to do what we all need. We're all trying to work together for this.
The other piece of advice? Take the vaccine when you can.
Both Moderna and the Pfizer vaccine are just as good with this variant as they are with the old strains. So there'll be no difference in protection whether this becomes widespread or not.
Everyone hopeful it will not. Dr. Oldfield says if there is any good news about all of this, it's that now that the strain has been detected in Virginia, VDH, the Department of Health, can better study it. He says knowledge better for us all. Brett Hall, 10 on your side.